U.S. health officials drop 5-day isolation time for COVID-19. Americans who test positive for COVID-19 no longer need to stay in isolation for 5 days, U.S. health officials announced Friday. The Centers for Disease Control and Prevention changed its long-standing guidance, saying that people can return to work or regular activities if their symptoms are mild and improving and it's been a day since they've had a fever. The change comes at a time when COVID-19 is no longer the public health menace it once was. It dropped from being the nation's third leading cause of death early in the pandemic to 10th last year. Most people have some degree of immunity to the coronavirus from past vaccinations or from infections. And many people are not following the 5-day isolation guidance anyway, some experts say. Our goal here is to continue to protect those at risk for severe illness while also reassuring folks that these recommendations are simple, clear, easy to understand, and can be followed, said Dr. Mandy Cohen, the CDC's director. COVID-19 is not causing as many hospitalizations and deaths as it did in the first years of the pandemic. The change is an effort to streamline recommendations, so they are similar to long-standing recommendations for flu and other respiratory viruses. It may not be as stringent, but the guidance emphasizes that all people with respiratory symptoms should stay home while they are sick, said Dr. David Margolius, the head of Cleveland's health department. People are likely still contagious when they test positive, and that hasn't changed, said Jennifer Nuzzo, director of the Pandemic Center at Brown University's School of Public Health. If you have symptoms, stay home until your symptoms are mild and improving, and it's been a day since you've had a fever. But then you can remain cautious by wearing a mask and keeping a distance from others. However, the CDC guidance for workers at nursing homes and other healthcare facilities is staying the same. That includes a recommendation that medical personnel stay home at least 7 days after symptoms first appear, and that they test negative within 2 days of returning to work. The agency is emphasizing that everyone should still try to prevent infections in the first place by getting vaccinated, washing their hands, and taking steps to bring in more outdoor fresh air. My biggest worry in all of this is that employers will take this change in guidance to require employees to come back to work before they are ready to, before they feel well enough, and before they are not likely to pose harm to their co-workers, Nuzzo said. COVID-19 remains especially dangerous to older people and those with other medical conditions. There are still more than 20,000 hospitalizations and more than 2,000 deaths each week due to the coronavirus, according to the CDC. This week, the CDC said seniors should get another dose of the updated COVID-19 vaccine.